All right, good afternoon, everyone, and welcome to today's webinar on Transplant Peer Mentors, a new approach to enhancing the patient experience. My name is Deanna Fenton, Program Manager here at the Alliance, and I'd like to briefly walk you through a few of our housekeeping items before we go ahead and get started with today's program. As always, to ensure an optimal visual and audio experience, it's highly recommended that you access our webinars using the Chrome browser. If you're already using Chrome and experience any audio issues, we do recommend reconnecting to the webinar using the phone number that was provided in your confirmation email. To anyone that's joining us for the very first time today, please take note of the chat feature that's located in the bottom left-hand corner of your screen. This chat will be used to pose your questions to our presenters. So if you have any questions that come up during the course of the webinar, please feel free to submit them at any time. Once the presentation has concluded, we'll go ahead and transition into our Q&A discussion where our presenters will address as many of your questions as time allows. Now, for anyone interested in our upcoming webinars, please note registration is currently open for our next Get Connected webinar on donation champions, strategies for developing advocates inside and outside of the hospital. That's coming your way on March 10th at 2 p.m. Eastern. Now, registration is also open for our next Transplant webinar on expanding the donor pool through utilization of perceived marginal organs. Be sure to tune in for that on March 24th at 3 p.m. Eastern. For more information on all of our upcoming webinar offerings or to register, please visit our website at organdonationalliance.org. Now, for anyone seeking continuing education credits, we are offering one CET-C credit and one nursing contact hour for this webinar. Please note we do also offer a certificate of attendance for anyone that's seeking CEs that are not available. Everyone joining us today is eligible to claim either of these credits or certificates. Prior to receiving your certificate, you will be asked to complete a brief online evaluation that will allow you the opportunity to provide us with your valuable feedback. If you are listening in a group, as many of you are, please be sure to get the evaluation email from your group lead. As a friendly reminder, you'll have 30 calendar days to complete your evaluations and claim your credits. Now, at this point in time, I'd like to introduce our moderator for today's presentation, Stacy Brand, Outreach Manager at the University of Michigan. Stacy, it's such a pleasure to have you with us today, and at this time, I'll go ahead and turn it over to you to introduce our speakers.
Thank you so much. I'm very excited to be moderating this session on Transplant Peer Mentors, a new approach to enhancing the patient experience. The University of Michigan Transplant Center at Michigan Medicine has been very successful with our peer mentor efforts and are pleased to be able to share our knowledge. Today, my colleagues will be sharing their expertise on peer mentoring, including the benefits of peer support and the steps to operationalize and sustain a transplant peer mentor program. We will also have the opportunity to hear from two peer mentors that will be introduced later. So I am pleased to introduce Colleen Satarino and Ruth Halben as today's presenters. Colleen received her bachelor's in psychology from the University of Michigan and her master of social work from Eastern Michigan University. She has been a social worker with the Michigan Medicine Adult Kidney and Pancreas Transplant Team since 2005. In conjunction with the Transplant Center Outreach Team, Colleen provides dialysis outreach support with the goal of strengthening relationships with dialysis staff and improving coordination of care for our mutual patients on the path to transplant. She is a certified clinical transplant social worker through the Society of Transplant Social Workers and is on the TWEETAN board as a research co-chair. Colleen has been involved with the Kidney Transplant Peer Mentor Program since its inception in 2012. Ruth has been an adult heart transplant and VAD social worker since 1996. Her graduate degree and internship were done at the University of Michigan in the Adult Heart and Lung Transplant Program. Since then, she has been employed as a heart transplant social worker, as well as one of the first VAD social workers. Outside of her clinical role, her interests lie in community building programs for our patient population. The social work team has a monthly support group, a quarterly newsletter, semi-annual gatherings in the summer and winter, an annual directory of patients, as well as the first transplant peer support program at University of Michigan and one of the first in the country when it was implemented in 1997. So I'm going to turn it over to Ruth Halben.
Welcome everyone to our webinar today. Our hope is that listeners will come away with a greater understanding of not only what peer mentors are, and the benefits of peer support, but also how to sustain a peer mentoring program. So let's start with this slide and ask the question, what is peer mentoring? Peer mentor support is noted to believe to be that no one travels this journey alone. If we look at this slide and look at the definitions of the individual words, peer, mentor, and support, I think we could put them in a sentence that says an equivalently matched, experienced advisor that helps carry the weight of, assist, strengthen, encourage, give help to another. In reviewing the literature for our talk today, there's a dearth of research on peer mentoring. However, in the review of the scant amount available, one program and one name are cited regularly. As you see on our slide, the National Kidney Foundation of Michigan, NKF, has some of the most collective literature on peer mentoring and has used a peer model in their dialysis community since 1994. Their work has grown into a national network of peers, and they call it peers. At the national level, a dedicated master's trained social worker is the program's director. In the number 3 spot there, we find Cindy Lee Dennis, PhD, who's a nurse whose work in maternal health and breastfeeding mothers set a goal to effectively develop, implement, and evaluate peer interventions. During her doctoral and postdoctoral studies, she conducted a concept analysis of peer support. Based on this theoretical work, she demonstrated that through mutual identification, shared experience, and sense of belonging, there is evidence to suggest that peer support can positively affect psychological and physical health outcomes. The literature also tells us that peer support can be best understood if you consider these common principles. It's voluntary, it's non-judgmental, it's empathic, it's respectful, it's honest and direct communication, and it's mutual responsibility. Some of the benefits of peer mentoring, and while this list is not exhaustive and I won't read each one, I would like to point out my favorite, and it's 1, 2, 3, 4, 5, down, living proof, been there, done that. Pretty much says it all, right? Sorry. But there are also benefits for the peer mentors themselves. And yes, these benefits are things that our peer mentors tell us about in their role. And the primary one is that they tell us it gives them a sense of purpose. And evidence has shown that people who help others have higher rates of physical health, life satisfaction, and lower rates of depression. They're also likely to be more optimistic about living longer. It can also reinforce the self-help skills of peer mentors. And these are some of the outcomes of peer mentoring. There is potential to increase one's ability to self-manage care with reinforced learning of disease management skills. Peer mentoring enhances self-esteem, self-efficacy, and healthy living behaviors. It can improve one's confidence in communicating with their physicians and clinical staff in discussing their care. And access to a peer modeling enables positive adjustment, navigation of the health system, and positive relationships with clinicians and caregivers. In 1996, I was a graduate social work student at University of Michigan with a field placement in the U of M heart transplant and lung transplant program. I was a non-traditional student whose former work was in management, so I was asked to reach out to the support group leaders from around the state to explore training them in leadership skills. We gathered, but what came out of the meeting was a group who were already leaders and, in fact, would call themselves frontline leaders, whose hard work produced the first known statewide symposium for transplant patients and their families in Michigan. While there were many great speakers and exhibits that day, the most significant and moving moment for me happened when a lung candidate stood to ask a question of the group. And essentially her question was, "Am I worth it?" A heart recipient stood and asked any other recipients in the group to stand as well, if they supported this patient's pursuit of transplant. The entire room came to their feet. There were over 500 attendants that day, and I was sold. So peer mentoring is long-standing at Michigan Medicine, and on this slide you can see the timeline. After the symposium in 1996, a heart recipient contacted me in 1997. He wanted to volunteer and specifically wanted to meet with hospitalized patients as he had been hospitalized for a lengthy period prior to his own transplant. He felt he could have benefited from this type of support. I thought it was a fantastic idea, but as a clinical social worker, I also recognized that this might be difficult to do given patients' rights to privacy. I consulted with a colleague who had done a lot of work in this area, including publishing on the topic. She worked with the dialysis population, and she directed me to, yes, the National Kidney Foundation of Michigan, where I learned about peer mentoring. I was able to link my patient to this resource where both he and his wife, as a caregiver, received training. My colleague eventually trained me using the NKF model, and I eventually trained others. In 2012, our transplant center decided to offer peer mentoring to all of our patients, adults and peds, as well as living donors, and pre- and post-transplants as well. They understood they'd need a staff as well as other resources to maintain this larger program. They also knew that they would need the medical team's buy-in to this type of patient-to-patient contact. Colleen will discuss how our transplant center partnered with our Office of Patient Experience. But first, let's take a closer look at peer mentoring at Michigan Medicine Transplant Center. I'm very proud to say that peer mentoring is now integrated across our transplant center. I do want to point out, though, that while not shown in the slide, it is also offered to our pediatric and caregiver population. Our pediatric colleagues tell us that patients and their caregivers go through the formal training that the Transplant Center offers via the Office of Patient Experience. Peer mentors are called on to meet similar families who are in the ICU or otherwise hospitalized. Caregiver training is offered in each of Michigan Medicine's transplant peer programs via the same experience as the transplant patients. Now let's take a look at some data. I call this peer mentoring by the numbers. This slide was compiled from our annual peer mentor celebration and shows that while each program is diverse in its approach to mentoring, they are also homogeneous. Notice the number of mentors and the hours they fulfilled. In the heart program, we have 6 peers and 196 hours logged for 2018. Kidney patients are 39 recipients and 13 living donor peers with 400 hours logged. Liver patients, 8 peer mentors and 160 hours of volunteering. And the lung group has 10 peers and 120 hours. And now we'll take a look at each individual program and how they operationalize those hours. As I mentioned, the peer support in heart transplant was born in the support groups. Meetings are held monthly with each of the 3 MSWs facilitating. Speakers are scheduled, and open discussion and time for sharing is always a must. Our peers meet with patients also at their initial diagnosis or at any time throughout the transplant or LVAD experience. They do this in the hospital or via phone contact. We sometimes arrange for them to meet during a clinic visit. We also publish a quarterly newsletter and an annual patient directory. As this slide shows, these are photos of some of these activities of our picnic, of our patients receiving their awards. This slide will show you other photos of these events, including a photo right there in the middle of our caregivers who get recognized as well. And since 2017, all newly evaluated heart transplant and LVAD candidates receive a copy of Heart to Heart, a book of patient stories, as part of their psychosocial education. These biannual social events are where patients and their caregivers are recognized for their transplant and LVAD journeys, as again depicted in this photo. All of these activities are managed by the clinical social workers of the heart transplant and LVAD programs, with the goal to build a community for our patients. Our liver transplant colleagues tell us that their peers make hospital visits to talk to patients about their own experience with transplant and provide some general peer support. They also do this via phone calls. Peers are also involved in the pre-transplant education class, where they form a panel to respond to questions from new patients. Our liver colleague shared this letter from a patient about her experience with a peer mentor, and I'd like to share it with you. Thinking back on it, hearing from the volunteers as we were working on getting listed for transplant gave us a perspective on the reality of it all. Seeing is believing. Hearing their stories at the class, even though some of the experiences were different, gave us hope and courage. One of the volunteers would run into us in the hallway, and he'd always stop to talk. We still thank him for his kind words whenever we pass each other. Later, when I was in the hospital for many months prior to my transplant, there were times when we weren't sure if I would make it. The volunteers who visited me were 10 and 20 years out of their transplants. Talking to them took me out of what I was going through at the time, and it meant a lot to me to see them going strong after so many years. They visited me often and made me feel uplifted. When I didn't know how much longer I could go on, when I didn't know how much longer my family could go on, I would have these visitors come, and they were cheering me on. I'm now 5 months out from my combined liver-kidney transplant, and we've already put our names in the hat to go through the volunteer training. It means a lot to us to think about giving hope to others, just like the volunteers did for me. Our lung social work colleagues shared that a common peer-mentor interaction occurs when a pre-transplant patients who are ambivalent about moving forward and making their decision are paired with peers who share their own experience of ambivalence and why they chose transplant. Post-transplant, peers are often called to come to the hospital when patients have had long stays to provide hope and encouragement. Our lung social workers try to match patients to peers who may have had similar experiences. Our lung colleagues tell us that the positive outcome of the interaction is the connection between the patient and the peer mentor. They also shared this example. There was a patient who was struggling with depression and was resistant to seeking psychiatric care. A lung peer mentor who also struggled with depression contacted the patient, and through their shared personal experience, encouraged the patient to seek mental health treatment. Powerful stories, I'm sure you'd agree, and today we're privileged to have two guest peers whose stories are equally powerful and will be shared with you. But first, Colleen will take us through the kidney transplant and living donor peer programs, and then she's going to tell us how all this works and what occurs behind the scenes. Colleen.
Thank you, Ruth. As a kidney transplant social worker, I have seen countless examples of the closeness that occurs between two patients who share their transplant journey. The immediate recognition between a peer and a patient is a beautiful spark. I've witnessed this meaningful interaction countless of times during our frequent visits to dialysis centers. We bring along kidney recipient and living donor peer mentors to join our outreach team, to encourage patients to consider transplant and to be the cheerleader during the long wait until transplant. Kidney recipient and living donor peer mentors also attend our twice-weekly education class for new potential kidney recipients and new potential living donors. We invite kidney recipient and living donor pairs to tell their story also at various community education events to promote living donation. Recently, our surgeons and our peer program established monthly meetings with hospital residents to give training physicians the opportunity to hear directly from peer mentors about their patient experience in transplant. Also, kidney recipient peer mentors visit new patients during their hospital stay immediately after transplant. As listeners to this webinar, your transplant center experience may be on the continuum from looking to start a peer mentor program from the ground up to having a vibrant peer mentor program in place. Wherever you are on this continuum, discussing the nuts and bolts of how our peer mentor program functions may be useful to all of you. Developing communication standards and staff involvement to give a foundation for our peers to stand on is so important when they're representing our transplant center with other patients and in the community. Ultimately, it is our goal in developing peer programs to identify opportunities for peer mentors to share their story and to encourage other patients on their transplant journey. As we reflect over our experience at Michigan Medicine, establishing a peer mentor program began with interest, which led to the need for resources, which is essentially staff and peers, and then training and sustaining. This slide outlines 6 steps when developing a peer mentor program. And number 1, I mentioned the difference between formal and informal peer mentoring. So formal peer mentoring is what our trained peers do in the community in representing our transplant center. But informal peer support happens regularly between patients and families in waiting rooms, in the lab, at dialysis centers, during support groups, and in the general community. These patient interactions are casual and personal to each party. Including patients as representatives of the transplant program and as officially sanctioned peer mentors requires training and an organization to support their volunteer work. A peer mentor coordinator oversees the volunteer work of the peers by arranging training for new peers, connecting peers for hospital visits or phone calls, managing a calendar of peer opportunities, and providing support and debriefing when peer mentors have a particularly challenging interaction with a patient. In our center, either our outreach manager or our social workers fulfill these duties. As you saw in previous slides about peer mentor activities across our center, peer mentors can function in various capacities depending on the need, and that's something that you can also think about as far as the need for your program. It's also important to have a process of identifying and reviewing peers, which I will talk about in a minute, and then training and sustaining is key. Peer mentors have been embraced in many different medical and mental health settings, as Ruth mentioned earlier. On this slide, I have chosen a few of the ethical and practice guidelines that were developed by SAMHSA, the Substance Abuse and Mental Health Administration, for peer-to-peer interactions with individuals who are recovering from substance abuse disorder. Establishing practice guidelines based on ethical principles sets a firm foundation of behavior and interaction between peer mentors and patients. Peer mentors are expected to interact in a respectful way and embrace diverse backgrounds and experiences. Peer mentors emphasize the strengths of their fellow peer as they also acknowledge their challenges. And peer mentors' role and contribution is to share their personal experience rather than giving medical advice. These guidelines help to instill trust between peer mentors and the medical team. Our Transplant Center Peer Mentor Program is a thriving program due to the dedication of our peers, our social work staff, and outreach teams. And over the last 7 years, a strong relationship has been built between the Transplant Center Peer Mentor Program and the hospital-wide Patient and Family Centered Care Office, which is now known as the Office of Patient Experience. The Office of Patient Experience mission is to promote and sustain the ideal patient experience through excellence in patient and family-centered care. The Office of Patient Experience commitment is to improve the experience of our patients and families through leveraging of best practices and resources across the institution to increase the value we provide within the health system. Peer mentors as support for patients and families is definitely an important part of the ideal patient experience, and our peers are definitely a valuable resource. This slide demonstrates the expansion of the program over the years, from organ-focused to transplant center-wide to hospital-wide integration. At the beginning of our collaboration with the Office of Patient Experience, we met as a combined group, transplant center social workers and outreach staff, Office of Patient Experience staff, and peer mentors to revise the Transplant Center Training Manual to apply to peers in all areas of Michigan medicine. The Office of Patient Experience has now helped several other hospital programs to develop peer mentoring. New peer mentors may be identified by physicians or staff, or patients may self-identify. In our program, a social worker discusses the potential peer with their primary physician, as well as review the medical record to identify any psychosocial barriers to becoming a peer at this time, as well as medical issues that may be happening at that time. If after review we're concerned that a peer mentor may not be ready for peer-to-peer interaction, we may recommend that they volunteer in another capacity. Our transplant peer mentors receive the Michigan Medicine Volunteer Training and peer mentor specific training in one day, conducted by the Office of Patient Experience. These trainings occur 6 times a year. Peer mentor trainings lay the groundwork of the role of the peer, boundaries and interactions, interacting with patients from diverse backgrounds, empathy, and listening skills. Trainings are led by an Office of Patient Experience staff or social worker and a current peer who present these topics together. The second half of the training gives peers the time to develop a condensed version of their story that they can share during a brief interaction. Peers will role play an interaction with another peer. Practicing being the peer and then the patient helps individuals become mindful of their communication style. Some peers may be eager talkers and they need to work on being quiet and listening, while others are more reserved individuals and seek conversation starters to have an easy entry into talking with a peer or with a patient. One of our most dedicated peer mentors was very quiet at the training session, and I was concerned that he wouldn't continue. Several years later, he has become one of the most active and dedicated peers in our program. At the end of the training day, peers then meet with their peer mentor coordinator to have specific discussions about peer mentor opportunities in their program and communication and organization structure. A peer mentor program may flourish and grow or become stagnant, depending on many factors. Certainly, peer mentors' health or availability varies over time. Transplant staff is needed to organize the program, and their time may be a varying factor. Maintaining connection with all trained peer mentors through social gatherings is a great way to build community. Regular newsletters and phone contact keeps peers in the loop, even if they cannot volunteer for a period of time. A peer mentor's health can change quickly, and we don't always know of this change. Stacy tells a story of one of our peers who she called to make a phone contact, and he quickly agreed to make the call that day. Stacy later found out that he was actually in an outside hospital at the time. Afterwards, he said he didn't mind making the call since he was feeling okay and just resting in bed. So that really shows his devotion to peer mentoring. The Michigan Medicine Transplant Center Peer Mentor Program continues to grow as a result of the synergy between our hospital partners, staff and leadership support, and the ongoing dedication of our patient peers. As staff, we create the structure and opportunity for peer-to-peer interaction, and then watch the magic happen. We gather once a year to thank our transplant peer mentor volunteers. This is a photo from one of our annual celebrations. This event is a time to celebrate our peers, thank them for our time, and provide a brief retraining on key topics or updates within the Transplant Center. Our peers comment that it is also a great time to meet peers from other organ groups and hear each other's stories. At our 2019 celebration, our peer mentors worked together and developed the following purpose statement. With empathy, we provide support, encouragement, hope, and education through our experience for patients and families on their transplant or donation journey. Now, I have the pleasure to introduce our first peer mentor speaker, Taneisha Campbell, who will tell her story. She received a living donor kidney transplant on February 15, 2008, and she is the Community Relations Coordinator for the Gift of Life Michigan Minority Organ Transplant and Tissue Education Program. Welcome, Taneisha.
Thanks for having me. My name is Taneisha Campbell. I was diagnosed with glomerular nephritis at the age of 8. Originally, I was diagnosed with urinary tract infection. However, my mother knew the diagnosis was wrong and pushed for further testing. Eventually, we got the diagnosis, and doctors explained to my mother that I would eventually need a kidney transplant. However, my mother never shared that information with me because she didn't want it to be a hindrance while I was growing up. I graduated from high school with honors and went on to attend the Tuskegee University. And while on summer break with my best friend and working for my cousin, my kidney shut down. I immediately started dialysis the next morning in Charlotte, North Carolina, and I was on dialysis for the next 18 months. My mentality during this ordeal was set up by the nephrologist and the dialysis technician in North Carolina. They walked me through every step and made sure I understood this procedure, as well as finding a living donor. I eventually transferred to Michigan, where I continued dialysis. My family and friends began testing, and my cousin Crystal was a match. I'm not sure how I found out she was a match. I can't remember who told me. All I know is we set a date, and we were extremely excited. We went through with the transplant, and here we are today. There weren't many people our age to talk to during that time. So Crystal and I often discussed how we could reach out to people who had no clue about transplant and what to expect before and after. And out of amazement to me, U of M reached out to me to become a peer mentor. Crystal lived in a different state. Crystal lived in Maryland. So I get to go out and share my story and knowledge with people who are going through similar experiences. People need to hear positive stories. You hear so much negativity about dialysis, and in my view, it helped to prolong my life until I was able to receive a kidney from my cousin. I help people realize that everyone's story isn't their story. The most meaningful interaction I've had is with a mother who was terrified. Their child had a transplant, and they weren't sure about the future. They weren't sure if their child could live a normal life. Now the mother is a huge advocate for donation, and her daughter is graduating from college and flourishing in the community. This is more than being a peer mentor. It is about doing good for others. It is about creating what you see is missing. It is about transforming the negative into a positive and being grateful. Thank you for having me.
Thank you, Taneisha. And now it's with great pleasure that I introduce to you one of our heart transplant peer mentors, Rachel Kuntzsch. Rachel underwent her transplant in November 2018 and became a formalized and trained peer mentor in August of 2019. Rachel.
Thank you for having me as well. First, I just will offer a little context about me. I am married to my husband, David, for 23 years. I have 2 boys who are 19 and 16, and I co-own a public policy consulting firm. I also live a very active life. I've spent most of my adult life running, skiing, kayaking, doing anything active. And so because I was a very healthy, active 44-year-old with no medical issues whatsoever, I was not overly concerned in November of 2018 when I went to my family doctor after experiencing shortness of breath and general fatigue for a couple of days. I assumed that I was maybe developing a chest cold, having run myself ragged in recent weeks between running a business, taking care of my family, and just the busyness of life. However, at the doctor's office, an EKG showed that I was having a major heart issue, and I was quickly taken to the hospital by ambulance, where a CT scan and a heart cath and other tests revealed that I was inexplicably in congestive heart failure. And I was initially diagnosed with stress-induced cardiomyopathy, so I had no history of medical issues, nor did anyone in my family have any history of heart issues, so this was an incredible shock. After nearly a week in the ICU, I was getting progressively worse, and my cardiac output was around 25%. In addition to my heart, other organs were beginning to show signs of failure, and I made what I think was a life-changing demand to be transferred to the University of Michigan. That patient advocacy, I believe, saved my life. At University of Michigan, I was immediately taken for a heart biopsy, which revealed that I actually had a condition called giant cell myocarditis, which is a very rare and irreversible condition with an unknown cause. And the only solution was a heart transplant, and I needed one within days. So everyone in my family, friends, rallied beside me, and everyone was in great shock that this was happening. I was immediately placed on ECMO, which is a life support system to ensure that my organs and tissues received adequate oxygen. And because of the severity of my condition, steps were taken to quickly place me on the transplant list. I was the status 1, and miraculously, the day after being placed on the transplant list, Thanksgiving Day of 2018, a donor match was found. And it was truly a Thanksgiving miracle. So I had a successful surgery during the night. Just to recap how fast things happened, I arrived at U of M on a Sunday. Monday I had a biopsy. Tuesday I received the diagnosis and was put on ECMO. Wednesday I was placed on the transplant list. Thursday a donor match was found. And Friday a new heart was beating in my chest. From the visit to my family doctor to having a new heart beating in my chest was 11 days. Regaining my physical strength and adjusting to the changes in how my heart operates, adapting to medication, not to mention adjusting to how life had changed in such a short period of time was a lot to take in. The nurses and doctors and social workers and physical therapists and so many others that provided exceptional caregiving at University of Michigan helped me to recover. The day that a peer visitor and 25-year heart transplant veteran came to my room was enormously impactful on my well-being. Here was someone who had been through similar experiences many years prior and was living a full life. I did not have the opportunity to fathom what was happening to my body as it was happening. So having someone come into my room who could answer questions, including ones that I did not even know I had, was very helpful to me. Additional peer mentor came the following day, and they also were enjoying an active and full life. They could share things that medical professionals could not because they'd actually been through it. Although I have a deep faith and was optimistic for a full recovery, the peer visitors gave me a physical representation of hope. An experience like this changes you. And I am grateful to God and my heart donor and the team at Michigan Medicine and my support network. But I have a greater appreciation for what it means to be there for people when experiencing medical crises. And the peer visitors at Michigan Medicine made an enormous difference to me, such that I knew right away that when I got through my recovery, I wanted to be one as well, so I could help people in the way they had helped me. So last summer, just 9 months after transplant, I went through the training at U of M, and I have visited patients that are recent heart transplant recipients as well as those that are waiting for transplants. Hearing other stories and being able to offer some perspective based on my own experiences, has been extremely humbling and rewarding. Our heart stories are all different, but we share a common bond and a deep sense of gratitude. One recent experience that stands out is a woman I've gotten to know that had heart issues since birth. She's been through many surgeries, and as of last year, she went on the transplant list for both a heart and a kidney. When I met her, she'd been waiting inpatient for months and was growing frustrated, yet her fighting spirit was so evident. We stayed in contact by text as well as additional visits. When I received her text that said, "They found a heart and kidney for me. I go into surgery tonight," it literally took my breath away. I could identify with the excitement and fear she was feeling. I have visited her since her surgery and heard the whole story, and have been able to answer a few questions and offer support and empathy. When I left her last, she wept and thanked me for the support over those months, but the fact is she has helped me as much as I have helped her.
Thank you, Rachel, and thank you, Taneisha, for sharing your stories. No matter how many times I hear these stories, they always touch me, even if I've heard the story a million times. So I want to thank Colleen and Ruth for presenting today, along with Taneisha and Rachel. These are just some references that they had shared with you. And now I'm going to turn it back over to Deanna.
All right. Thank you, ladies. Thank you, Colleen and Ruth, for such an insightful presentation on the benefits of peer mentors. We're now going to go ahead and open up the floor for questions. But before I go ahead and turn it back to Stacy to facilitate our Q&A discussion, I'd just like to remind everyone that if you do have any questions for our presenters, please be sure to submit them using the chat feature. As a quick reminder, it's going to be located at the bottom left-hand corner of your screen. Additionally, during the Q&A session, I'm going to have this poll up. So for those of you who are listening in a group, if you could please just complete this poll and let us know how many people are participating in your group. All right, with that being said, I'll go ahead and turn it back to Stacy. Thank you.
Thank you. So the first question that I have is going to be for the peer mentors. So I want to know, what are some common questions that patients have asked you in your encounters with them?
A few of the questions that I get would be, how many medications do you take after transplant? And then I'll go back to, every story isn't the same story. So I may take 4 medications. I'm not even sure if that's how many I take. But another person may take 12 medications. It's all in how your body is reacting to the transplant. So remind people not to take another person's story as being their story.
Yeah, I've had the same experience. A lot of questions about medication, but also around, like, how long did it take you to get to X? Whether that's, feeling like yourself again, feeling like you could do the things you used to do, all of those kinds of things. And like Taneisha, I always say, everybody's story is different in my case, and then offer what my experience was, rather than telling them what they should expect.
Okay, so another question for the peer mentors. When you're meeting with patients or families, what questions have you been asked that you might share with the professionals that are involved that could lead to better practice?
Oh, that's a good question. I think we're so well trained in what we do that we don't really receive a lot of questions that would change the program, because it's such a great program. I'm not sure. I'm really not sure. You have it?
Yeah, I think less a question, more an observation that I hear a lot of patients, and I know it was my experience as well, is that transplant patients are often waiting for therapeutic drug levels to go home. And so they're told every day, today might be the day. And oftentimes it is not the day. And so there's disappointment day after day after day. In fact, I just talked to a patient yesterday where she's feeling very frustrated because she's 5 weeks post-transplant and she's still waiting. And so she's given up the hope of, not of leaving, but just of when they tell her that, she doesn't believe it. So one thing that I think is an attempt to provide optimism, but one thing that it does actually is bring the patient a sense of hope that then falls away. So that would be something that could be changed so that patients could feel hopeful and yet not let down, and that doesn't always happen.
Okay, I have a question for Colleen. You read the purpose statement for the peer mentor. Can you just talk a little bit about how that was created?
So yes, we had a team from our, you would know better than I would, the team that came in and assisted the peers, Stacy.
Oh, they were part of the quality team from
Yes.
Michigan Medicine.
Right. So the quality team really led a workshop to help the peer mentors to identify their strengths and to really come together and create a statement that they all really could support. And there were even, I think, just a little bit of voting and who likes this phrase and who likes that phrase, and then they really kind of came to what we have as our purpose. Do you remember anything else from that?
I think that covered it. Okay, great. So Ruth, I have a question for you. So you've been involved with the peer mentor program for a long time now. So is there something that stands out for the amount of time like that's gone on, something that really stands out about peer mentoring over all the years that you've been working in the program?
Well, I think, as I mentioned at that initial meeting in 1996 where we pulled together the support group leadership, I guess, for lack of a better word, to make sure that they felt like leaders. And when they came together and recognized they were leaders, but standing in that room with them, when unprompted, that woman stood up and asked that question, and she got such resounding support. Every single person in the room was on their feet. I had not, up to that point, been a big fan of group discussion about, I think as social workers we hear about support groups where everybody just comes and complains and nobody does anything about my problem kind of thing. And not that I necessarily believe that, but I just didn't have a lot of experience, and that really changed things for me. Really changed things.
Okay, I have one last question for the peer mentors. So how has being a peer mentor changed your life?
I think, I'm a little near to my transplant, but it's going through something like that kind of connects you to yourself a great deal, and getting back into the world, back into the fast lane, you can start to feel disconnected. At least I know I have at times from that experience, and it brings me back every time I meet with a patient in a good way. It reminds me of everything I have to be grateful for. It reminds me of what I went through and on the other side of, and to not take advantage of anything. I think most people who've been through transplants value every day of their life, and being able to meet with patients is a very tangible reminder of what we've been through and what we have to be grateful for.
And I think just to piggyback off a little what Rachel said, when we talk about being peer mentors, we are also talking about talking with their family members as well. Oftentimes, the patient's families are with them at that time. So we're giving not only the patient hope, but we're giving their family the hope. And we're showing them what, I'm 12 years out, we're showing them what 12 years out, what 1 year out looks like. They're looking at us as them in the future. So I think it gives us a refresher. It gives us a purpose. It just helps us to remain humble and realize that we're all in this together and take care of those transplants that we have. Mm-hmm. They're very precious. So. Mm-hmm.
Taneisha, another question for you. Can you share a little bit about your role at Gift of Life MOTEP and your role as a peer mentor and how things that might get combined sometimes?
Okay. So I am the Community Relations Coordinator with Gift of Life Michigan, MOTEP, the Minority Organ Tissue Transplant Education Program. And my role there is I primarily go out and educate people about the importance of organ and tissue donation. My main focus is youth education. With all the myths that are out here in the community, we find it easier to dispel the myths in the youth community, and then they take it home and dispel it with their family members. Oftentimes it will surprise you that when I go out to these schools and everything, it's students there at those schools that have had transplants, or they know somebody that's waiting for a transplant, their family member has had a transplant. And when I share with them that I've had a transplant, they're often amazed. I'm not sure what a person who has had a transplant is supposed to look like, but they're often amazed. They're often amazed that we are able to walk around freely and not look like we are battling against something. And I find it amazing, too, sometimes that even though I get up every morning, I take my medication, I go to bed and I take my medication every day, sometimes it's just a routine that I have, and I often forget, hey, I'm taking this for my transplant. It's just a routine. But I like my job, and I like the peer mentoring part because in reality it is my life. I'm a patient recipient. I'm also a donor family. My nephew was an organ and tissue donor when he was 5 months old. My cousin is a living donor. My uncle is a donor. So this is the reality of my life. We are donors and recipients, and we like sharing our story and, to motivate people who look like you are around your age. It's exciting to see that frown that's on somebody's face turn to a smile.
Well, thank you. Well, I want to thank everyone for participating today. It doesn't look like there's any more questions in the queue. So on our behalf, I want to thank everyone.
Thank you.
All right, thank you, Stacy. I'd just like to, of course, echo your sentiments and conclude today's webinar. So on behalf of the Alliance, I do want to extend a sincere thanks to Colleen, Ruth, and Stacy for taking the time to join us to facilitate today's discussion. Additionally, I'd also like to extend a special thanks to both of the peer mentors who were able to join us today. Taneisha and Rachel, thank you so much for your willingness to share your stories with all of us today. To our participants, as always, we thank you for taking the time to join us, and we look forward to seeing you again in the future. Enjoy the rest of your day, everyone.